Hello, everyone. This is Elvia Castro. I am the Associate Director for Charity Evaluation with the BBB Wise Given Alliance. I also work on the organization's Donor Trust Report series and surveys, and I work closely in this report with Art Taylor, our CEO. Unfortunately, Art Taylor is stuck in a flight, so you got a little bit of a downgrade. But it's my pleasure to join this conversation, and I'm happy to do so. So the report that we put together is called 10 Lessons in Organizational Transformation, what CHCs Creating Healthier Communities story tells us about effective strategic evolution. We've known the CHC team for a very long time. They've been a BBB accredited charity for many, many years. But during the past 5 to 7 years, we've seen them go through this strategic evolution from an organization very focused on collecting and redistributing funds to one that really worked hard to reinterpret their capabilities and their partnerships so that they could better advance community health and health equity. This, of course, sounds easy, but is much harder to do. And one of the things that I think really stuck with me from our conversations with the leadership is how much introspective work is required, the deep commitment of a very active board, and the combination of drive and patience that you all exhibited throughout this whole process. So for those who are out there, the report is available on our website at give.org. You're also, of course, welcome to email me directly. My email is on screen, elviacastro@give.org. But we have the privilege today of being joined at the very people who we learned these lessons from. So I want to put my focus on them. Before I go ahead and do that, please know that we have our own questions, and most of this will be a very conversational format. What we'll do is I have a few questions for each one of them, but we mostly want to prioritize your questions. So please, as you have questions, send them in the chat. Julie Riso, my colleague, is going to keep track of them and then come in later in the webinar to ask your questions. So please send them in. We very much welcome that. And right now, I expect you're seeing two versions of each one of these people. And if I wanted to go into all of their accomplishments and their history, it would take longer than the hour, so I won't do that, but I will quickly go through who they are. So we have Tom Boniano, the president and CEO of Creating Healthier Communities, for another 3.5 days. So it's a pleasure to have you here with us. We also have Jean Acquias, who is the incoming president and CEO for Community Health Charities. I'm meeting him today for the first time, as well as you all, or maybe some of you have already met him, but it's a pleasure. Sandra Nichols, who is Senior Vice President and CMO of Health Inclusion and Community Engagement with United Health Group, also CHC board member. Charlita Redmond, who is Vice President of Strategy Integration with the Children's Hospital of Philadelphia. That should say board secretary. Kevin Clayton, who is Senior Vice President, Head of Social Impact and Equity with the Cleveland Cavaliers, and he is the former board chair, and Adam Rothschild, who's an investor and consultant with the organization. So I'm actually going to take the second photo of you all out of the screen and stop sharing so that we can start more of a conversation format. And if it works for everyone, I'm gonna shoot the same question, the first question to you, Adam. Sorry, to you, Kevin. The organization is entering 2023 with over 25 million in grants for community health and health equity. Congratulations, that is a big increase in just 1 year. But before there was proof of concept for this new direction, the board had to take a leap of faith. And so my question to you is, as board chair at the time, how did you build the business case and support for this new direction?
Elvita, thank you for the question, and I'm grateful to be on this panel with my esteemed former board members and board members. When we began this journey, it actually was pre-COVID. And what we had identified was we were looking at our kind of traditional business and saw that there was a declining trend there. And it just had to do with giving patterns were very different. And we identified that what was ahead of us was really looking at the future. And the future had to do with the social determinants of health and those different areas that were really hurting America. And as we looked at the different key areas of focus, our board was actually ready to shift to taking a look at how could we best use our over 50 years of experience at a community level to bring resources to the neighborhoods and the zip codes and the street addresses of the people in most need. So the proof of concept, if you will, was the trust that the board had that we would be able to do that, because we had a history of really making impact in communities. What we didn't have a history of was really this new direction of focusing on what were the real needs from a community standpoint. And we knew that we had the power to convene community groups, community nonprofits, and people that were focused on this. And it was really an easy road to turn for the board, because we saw that this is the direction of community health. So with that, the board was 100% supportive. And as you said, within a short period of time, our ability to increase incoming revenue for us to then have that going back out to communities was not it was not a hard challenge for us to get there, but it did take some time.
Thank you. Tom, I've heard you say a couple times that you talked about the realization that for many nonprofits, there's this really strong but understandable need for self-perpetuation. I wonder if you could tell a little bit about how CHC thought this kind of instinct that many organizations have, and what would you recommend for organizations out there that perhaps are legacy nonprofits, or for whatever reason are trying to make a pivot, but they don't know where to start?
That's a good question, Elvia, and thank you, and thank Art, and thank the Better Business Bureau Wise Giving Alliance for this opportunity. Let me see if I can kind of provide some context to answer your question, and then you're going to hear from all of us probably some reoccurring themes. But it's natural for any nonprofit, any organization to really primarily look at self-perpetuation, self-realization, because we're all tied into budget cycles. We have almost by nature a short-term kind of an approach, and it's what we're doing this quarter, what we're going to do this year, and that sort of gets you into the business pattern of the year, but doesn't often allow you to take that step back. And that's what we did. And for any other nonprofit, this is a little bit true for our process, although this happened over a couple of years. The first thing any nonprofit has to be able to do, if not annually, at least on a regular basis, you really have to discipline yourself to take a step back and say, are we actually able to kind of change our tactical, our strategic direction without losing momentum? That was the first challenge. In other words, it's one thing to take a step back and say, is our mission still relevant? But you've got to do that simultaneously while keeping focus on your existing business. So that's tricky for any nonprofit, but certainly will prove worthwhile if they have a good plan to back it up. And I think the other thing that any nonprofit should do, and is certainly what we did, Elvia, is, again, we took that step back and we asked ourselves hard questions. And over time, we had some very brutally honest discussions. And I really want to stress that those are discussions that happened internally with our staff leadership, but most importantly for any nonprofit, they happened within the framework of the board of directors. We couldn't have done this without a partnership. Certainly myself with Kevin, Adam, Sandra, Charlita, the whole board. It has to be done in tandem. But every nonprofit periodically has to step back and really ask themselves the question, is what we're doing really accurately displayed in our mission statement? Does it reflect who we are and the work that we're doing? And honestly, if you can't answer that always in the affirmative, it's a clear sign that you need to make some changes and perhaps even look at altering that mission and your structure. I think one other important point too is that part of the brutal discussions, or the brutally honest discussions, is letting data drive the informed decision. And in our case, and I'll just say this very quickly, Kevin alluded to it, For over 60 years, we were probably one of the most successful organizations in the country at doing our legacy business, which is raising money for almost 2,000 of our nonprofit partners within the public and private sector arena. So you can call it employee engagement, corporate gifts, or workplace giving. We were very, very successful and effective. But by looking at the data, and not just paying attention to what we were doing, and again, being afraid to ask difficult questions, you began to see trends that while we were successful, the environment around us that dictated our success was changing. Donor attitudes were changing, philanthropy was changing, technology was changing. And so, I hope, directly answering your question, we had to embrace that, not hide from it, not pretend it wasn't happening, and not be afraid that if in fact we talked about those trends, that the conclusion wouldn't be maybe we wouldn't exist anymore. So it does take a measure of courage, and it does take a measure of transparency, but it's all founded on the role of the board. If your board is truly a strategic board, if it's an engaged board, if it understands its role, you have nothing to fear by asking those questions out in the open. And kind of just bringing it quickly to, I think some of the other questions you have for our panelists. When we did that, the risk wasn't great because the board basically said for 60 years, we've earned the trust of several thousand companies, several thousand nonprofits. Why would we want to waste those two powerful networks? What could we do with those networks that truly was going to be in alignment with our mission, which is building healthier communities? So I'll stop there because the others are going to talk about it, but there were things that were happening in this country that are still happening that didn't lead to everyone having equal access to having a healthier community. And that's how we pivoted.
And as a follow-up question to what you're saying, in every, I was going to say relatively large organization, but I would think it happens in any size organization. When you're making a meaningful jump, there's always bound to be some sort of pushback.
Right.
Did you have pushback, and
Yes.
what recommendations would you have around that?
Yeah, I mean, to continue with the theme of just being very direct and transparent with you and with everyone, it was understood that there was going to be pushback. And it's not nefarious. It wasn't because people were intentionally trying to block the progress. It's just that there was many decades vested in our legacy business. The safe thing to do was to stay in that lane. The safe and to be risk averse, we could just continue to perpetuate. Maybe those trends would continue to decline, but it would be several years. So that's number one, I think, understanding that instinct. Two, all of our competencies, our skill sets were built to match that legacy business. So it was very difficult to ask people to really consider how their jobs would change, what new skills they would have to acquire, what new competencies we'd have to bring into the organization in order for us to make that pivot. So I think the key is, it's naive to think that you're not going to get pushback. What's key, and Kevin played a huge role in this, what's key is how you handle the pushback, by not being defensive, by not necessarily dismissing it, ignoring it, or even shaming people for that pushback. It's how you deal with their objections and how you have a careful plan, communicate again, and communicate again what that vision of the new mission would look like. And that's something Kevin and the rest of our leaders on the board did, not only for the board, but I also invited them into a dialogue with all of our staff to have an open discussion.
Thank you. And for our participants out there, because Tom has 3.5 days left in his position, I think we can ask him really hard question. He's been really open throughout the process. It's just your personality, but I'm rooting for you all. Sandra, can you help us, build our understanding of this new direction? Can you tell us a little bit about the barriers to health equity in society, in the U.S. society, and how CHC is addressing these barriers?
When we talk about barriers to health equity, the things that automatically come to mind and that we're all well aware of is the overall access, the high cost of care, inadequate insurance coverage for our individuals, although we know there's Obamacare, Medicare, Medicaid, but inadequate is a key word. Unavailability of services, the lack of culture, competency, and frankly, language barrier, and just trust. If you don't have a provider that looks like you or speak your language or understand your culture, there is a trust challenges as a part of that. CHC has done a phenomenal job in focusing on multiple areas around how we can begin to break down that health equity and those barriers. We're working on such things as cervical cancer and breast cancer, and one of my favorite, vaccination in rural areas. As we talk about those things, one key piece I want to mention to us is what we see as an equity-based approach to ensuring safety for pregnancy and childbirth, because that's our future. If a normal, healthy mother can't have a safe pregnancy and certainly make sure that baby is born safe, we know that we have challenges. And clearly, we're the worst in the world. The morbidity mortalities that occur among Black women, in particular, their pregnancy is astronomical. It's worse than any third world country. What we are doing at CHC, or creating healthier communities, is that from the support, excuse me, of Elevance Health Foundation, we've launched the Black Birthing Initiative, which focuses on reducing the high rate of preterm birth among Black women and birthing people as a whole. And the initiative has been phenomenal, very successful. We're still in the midst of that, but very excited about what we're doing and how we're engaging these individual women in communities to help and to educate around how to have a safe baby.
Thank you. I mean, I think my reaction and probably everyone's reaction is how big a goal that is and how, how large a mountain that is to climb. But I think with many of our organizations, those goals are just really ambitious. Charlita, can you tell us a little bit about how CHC's board helps guide the organization, helps keep the organization in its lane with its new mission, and maybe what are the most exciting things that you see moving forward within this line of work?
Sure. Thank you for the question. So the board is a working board. I think many of the interviews that were gauged for this article and report outlines exactly how much this board is a working board. And it's one of the things that I would say how it's leveraged by CHC as the organization is, one, looking at how can we use the collective talent and expertise of the board members to help build the strategies. What this article is based on is really about the board providing an organization that had a vision from a board chair and a president, and then leveraging its existing board to say, what is it that you think we are missing? What can you bring from a value add? And where should we partner to move this forward? So there's a lot of work, sweat equity, as they say, put into where we are today, because the board was engaged by Tom and Kevin and the staff at CHC. So with that, we've got committees that individuals are signing up for. We have several individuals that are on more committees than is recommended because they are engaged. So one of the things that's building the strategy, providing the direction, and giving that honest feedback. One of the things that I would say is I'm most excited about, and we keep talking about, is for CHC to get the recognition it deserves. So as we have looked at partnering differently and leveraging that legacy work and the legacy partnerships, what we believe is an opportunity to continue to build the brand of CHC, not being in the background, but being in the forefront and really moving this work forward differently than it has. So I'm very excited about what CHC will have as a recognition, as well as the continued contributions that it has always had, yet maybe not been called out in the way in which the organization can be. So that's one of the things that I think myself and many others are excited about, is creating that brand, getting more people to know really who CHC is and what it brings to the table.
I mean, you've had, such great success in the short term since you made this pivot, that I have all sorts of faith that that will happen. So congratulations on what you've done so far. And one of the things that, the theme that keeps coming into or kept coming into our conversations was, um, health equity and the racial implication of health equity. In my conversations with many of you, I think there was a very clear distinction made between the program imperative of health equity in the community level, versus what might be DEI for the organization's board and the organization's staff. And so without, pushing you to closer that line, because I think they are distinct though related themes, I wonder, Kevin, if you could give us kind of your take on what diversity, inclusion, and equity are at the organization, and what's your advice for organizations that are struggling to diversify their boards, their staff, their partnerships, to better serve their communities.
Yeah, so when I think about the whole conversation about DEI and also health equity, to your point, they are distinct, but there is a converging point that I think is important that I share. CHC has always looked to have diversity as one of its core kind of pillars from a board standpoint. But when I say that word, I mean diversity from race, gender, occupation, years of tenure in business. So we looked at multiple dimensions of diversity that comprised our board. So that was a fundamental piece of our fabric of success. That started years and years ago. It wasn't really until the last maybe 5 or 6 years that we took a look at the whole conversation of diversity, equity, inclusion to talk about how we include that into our business strategy. So now it wasn't just looking around the board and counting the numbers of people we had that represented different dimensions of diversity. It's how do you create an environment where those people that you have around the board actually count instead of counting them. So that's really what we focused on, was understanding what are the different dimensions, what are the different experiences that people brought. And we specifically have looked year over year at our board to make sure that we had certain levels of understanding, certain levels of tenure in business, certain levels of focus on our board. So with that allowed us, that diversity of what our board looked like, that diversity of the different skills and competencies allowed us to even have a healthy conversation about health equity. Otherwise, it never would have happened. So while, yes, they're two totally different things, the concept of that was how do we leverage the different dimensions of diversity to help us in moving our organization to the next level. The last piece of what, as you said, the question was around helping others to really understand kind of DEI. If this is not part of a strategy, it really is just counting numbers. And we live it, we believe it, and we leverage the diversity of our board to help drive our strategy.
And Elvia,
Go ahead.
jump in real fast because I want to emphasize something that Kevin has said and that you've already heard from a couple of the other board members. It was important that we took the time to actually have those discussions and uncomfortable discussions. You're already referencing today terminology, and I already see people we already see this already happening, people fixing on terminology and what does this mean? I think one of the right things that we did was to take the time and actually ask people, what does this mean to you? What is the implication? And again, Kevin, Sandra, Charlita, Adam, we're all very patient about knowing that that wasn't a one and done. We just didn't do it in one meeting. We didn't do it in one staff meeting. And this gets back to your question of pushback or resistance. It was a very patient and safe environment to say, if you don't know what that really means, or perhaps you think it means this, but could we talk? Could you open your mind? Could you consider other viewpoints? It was a very patient process that allowed people to come along without feeling that they were being rushed or forced into something. And it gave the permission to be able to be honest. And in my case, and the board members can tell you, many times what they heard from me is, I need to know more. I need to understand more. Can you share with me what other resources can I use with the staff, with our leaders that we could use and understand and go along on this journey? So it's very important for any nonprofit. This isn't a one-time webinar. You can't just send out one article. It's a family situation where you're going to have an environment where there's got to be leaders like Kevin talking, but there has to be a lot of listening and learning in the organization to make this happen.
Yep. And Tom, one last point to that. You said something that we have not brought up yet, and that is we're talking a lot about the board. This was the board and staff working together. So everything that the board went through, staff, and I'm not talking about just senior staff, we reached out all across the country. So everybody knew and everybody understood. And if they didn't want to go on the journey, we gave them a gracious opportunity to one, to sit back and wait to see, but also if they wanted to get off the ride, they could. But this was not just the board, this was both.
And I wonder this, it could be for any of you, Tom, Kevin, Adam, maybe. I think one of the things that came clearly in our former conversations as we were drafting this report on how you did this is that it was a very patient process, right? So this process of bringing people along, and I think a lot of our organizations struggle with that because we want, we have a new DEI specialist and we want to see something within a year or within 2 years. And we start thinking about what does return on investment look like? And so I'm wondering if you could expand a little bit on a couple of things. One is kind of specific advice on what you did to get people comfortable with this new model and feel like they could thrive within it. Or on the flip side, if there is something that you wish you had done better, please share it because we're all bound to make the same mistake. But then, and I'm sorry, I'm combining questions here, but if you could speak more broadly about this issue of return, how should organizations think about the timeline when it comes to return on this type of decision making, and what is realistic to hope for? I think I asked too many of you and too many questions.
I'll give at least, there's a lot. I'm trying to unpack your question. So I'll start off and reflect back on one of the points that Kevin addressed very early on, which was the nature of our board in terms of diversity, equity, and inclusion. That has been part of the board framework structure for a very long time. And I would describe that, I'm not putting words in Kevin's mouth, but that's table stakes. That's just a measure of board health. And without that diverse group of perspectives, it's really hard to have these difficult conversations to ensure that everybody's voice is being heard and you're bringing everybody along. In terms of the return on investment and in terms of having a DEI specialist, I don't want to minimize the nature of DEI expertise and specialization. But if it is just a position, if it is just a metric or a table, we're missing the point. And this approach, this sort of, for us, the focus on health equity was built into everything that we were doing. It wasn't a program office. It wasn't a single position. It was reflected in the holistic strategy that has guided CHC moving forward. Kevin, anything that you want to add or correct?
No, I think you're absolutely right. And it started with the governance bylaws and everything in which, you and I for about 6 or 7 years built into it.
I mean, another thing that I'm not sure if it has come out kind of appropriately, but you put a lot of work into immersing the board into the community. So creating exchanges between community leaders and community representatives and the board so that they would be really kind of well exposed to the troubles and the barriers that they're trying to address. Can you tell us a little bit more about that?
Yeah,
Sandra or Carlita or Kevin,
Well, I'll take a first shot to tee it up because a number of my colleagues here participated. So, as you know, when you go through these kind of experiences, there's a lot of intellectual conversation. There's the panels, there's the speakers, there's the training. But I think it was a meeting that we had 4 years or so, 5 years or so ago in Cleveland, where we actually went out in the community to see what were the real issues that we had intellectually debated in board meetings. And when you begin to touch hunger, when you begin to touch joblessness, when you begin to touch health disparities in real time, when you begin to touch the disparities from an education standpoint, which is what we did, our board came back and those people who had not been on the ground were really now saying, wow, I now have a better feeling for what this is as we shift. And it wasn't theory, it wasn't training, it was being really on the streets with people of need.
And I would add, being part of the convening that CHC has done, especially around our board meetings, when the community of where we're meeting is brought in to be with the board. So the board is, side by side with leaders, community members, and individuals in our community-based organizations, and being at a table with a board member. What has been said to me specifically as a board member is, I know that you're engaged, and I know this organization is engaged because you are here. I'm hearing from the people that are driving this work, that are supporting this work, and you're embracing what I have to say. So I think that's also part of what CHC has done to bring people together within the communities and those that are driving this work at the grassroots. And it's important for that because the community is saying it's important, and hearing from the board, being side by side with board members, has been something that I think that has pushed this work forward and identified opportunities to engage even further.
And
just to add a quick comment to Shalita's and others' comment is that you will find that the initiative has truly engaged the voices of the community, and in engaging those voices have built trust. In most of our public health and systematic approach to things is typically pushing down to the community. These are the things we're providing for you. But the data point that we saw that's so essential is asking the community, how do you, in the driver's seat, help to solve the problem that's existing in your community? And that trust was built and those outcomes are in place because of that very unique and very partnership that was in place with CHC.
Just to add
Um,
one more, so I just add one more point to Sandra. And Sandra's been a strong proponent from the very beginning about the importance of the voice of the community, the voice of the community-based organizations, and that we needed to do things differently. We couldn't do it top down. We needed to go to them and listen to them and understand what was it that they needed. And so you talked about, engaging the board in these convening activities that Charlita referenced. That's part of how we operate now. We go, we listen, we incorporate that into our plans as we seek to work with them to find solutions. That's part of how we operate now. But by bringing the board in also, and again, this is a working board, it takes it, as Kevin pointed out, from these academic discussions, and it makes it real. And, in terms of the power of that reality and how you can use that to engage a board moving forward, the people who attended those convenings stepped up, and it goes probably a long way to explain, as Charlita pointed out, why we have such an engaged board, stepping up to join so many committees to do so much work.
Yeah, and honestly, the passion and the engagement of your board really comes across, and I think it's a huge asset to your organization. But to bring it a little bit down to kind of the building blocks of things, Adam, can you tell me a little bit more about what your advice would be to other organizations trying to recruit such a committed board and a board that is so well aligned with your new direction?
Okay. there are several ways I could answer this question. I could talk about our processes, our governance structure. As an example, there's been some references to, board competencies. And what we do on an annual basis is we ask the board to complete a survey, and it provides information that's important for public consumption, but it also enables us to identify strategic priorities in terms of board recruitment. So where do we have board competencies? Where is there a gap relative to our strategic priorities for CHC? And that those priorities are shared with the board and with staff. And we ask these groups of people and past board members to help us find board members who can help us on our journey. I could talk about our interviewing process, our onboarding process. We've got a board buddy system. This is all helpful, but I think the two things that honestly rise to the top is, and we've talked a lot about this, it's clearly documented in the report, is CHC's purpose and the role that the board plays. Specifically, Charlita talked about us being a working board. And we attract people who are committed to our purpose and they want to work. I can't tell you how many board members currently that I spoke to as part of the interviewing process. And what they were excited about was they wanted to get to work. They wanted to make a difference. They didn't just want to write a check. And that helps, that board, that working component of our board, I think helps us a lot. The other is, honestly, it's one of the reasons why I've served as long as I have on the board, and it's about relationships. This board is comprised of a bunch of terrific people. I've loved serving alongside them and have learned more than I ever thought I could have imagined from this group. And when you find a team like this, people want to be a part of it. People want to contribute and make a difference.
And it'll be real quick. I want to follow up a little bit because I think it's important for people listening, or if you're listening to the recording or however they access this discussion. As you're right, I'm after some 40 odd years, I am stepping down. You'll hear from Jean, my successor, in a moment. But I think it's really important to say this. A lot of nonprofits, candidly, and I'm talking about staff, execs, sometimes they're hesitant to build a board that's engaged, to build a board that actually does have a role in strategy and direction and mission. It can be risky, but I think, again, if you're hearing anything in our conversation, you would hear the distinct advantages to actually having a real board that's working, that's engaged. Now, I'm going to go back to what Sandra said. When we began to really look at the inequities and disparities, when we began to evaluate the definition of what a healthier community is, it pointed us directly to communities. And when you begin to hear voices at the community level, what that did is it caused us to question some of our tactics, some of our traditional relationship with our nonprofit partners for decades. It really caused us to say, in other words, ask very difficult questions. If everything we're doing is relevant and matters, why are some of these situations still continuing 20, 30, 40 years after they should have changed? Now, that's not an indictment, it's just a discussion. In other words, maybe there's some things we're not doing right or well enough, and it caused us to change tactics. But as Adam just said, it also caused us to really look at our recruitment and retention for staff and board. Because if you're going to listen to those community voices, you have to have a board that is competent and skilled at understanding what they're saying and then helping us translate that into tangible actions. So it does cause some ripples, and it will cause change. And it will have, as Kevin said, I think very eloquently, and I'm glad he did it, some people are not going to jump on board. But you still have to go. You still have to move ahead. All these things come from defining your mission, asking difficult questions, and then letting that information start to dictate your board composition, your staff composition, your business processes. Those are the real changes that occur. But if you don't do that, Elvia, and you're a nonprofit, you may not be in business 10 years from now.
Important. I want to open it up to the people who are out there and asking questions. Julie, do you want to join us and let us know what people have been asking?
Sure. We have a question from Bennett Weiner. If I understand it correctly, CHC's journey to making this transformation took about 4 to 5 years. Were there any lessons learned that might help organizations carry out a mission pivot that takes less time?
I'm smiling. Who wants to take that? I'll take a first shot at it, and I can see Kevin's already maybe formulating an answer to some of the others. Yeah, so the first thing I said, Bennett, is that number one, like forget it, it's not hyperbole. You've got to let the data inform your decision, have real conversations. You can do it in less time, but the balancing act is you still have business at hand. You still have to be able to maintain the business structure you have today. You still have staff that are engaged, and you have board that engage. So it's got to be a carefully planned process to continue to take care of the business, that, not to cause so much change that everybody leaves. There's angst and stress. So it's a matter of kind of doing two things at once, but it's going back to what Kevin really said and some of the others. While you're doing that, communicate, and tell people it's okay to feel a little bit scared. It's okay sometimes to feel a little bit confused, but again, pointing them towards the eventual goal of where we're going. It took us some time, but then again, if you look at what happened over the last 4 or 5 years in this country, the George Floyd incident, the pandemic, there were some monumental cataclysmic changes that happened in our society. I'm not sure what our original timeline would have been, but you also have to give room to those kind of environmental changes.
Yeah, and Tom, I'm glad you said that, because a lesson learned: don't do this when you have two pandemics, one a societal pandemic and another one a health pandemic. I would never suggest that you want to do that. Notwithstanding that, it actually propelled us, because of those two global situations, to reimagine ourselves. It forced us to take a hard look at what we had seen coming for the previous 3 or 4 years. The other thing that I would say is that I don't think the time that it took us was a long period of time. Honestly, I'm shocked at the results that we have had on the timing. If you think about some of the numbers that were just referenced, from being able to be a player in a very new market with just a few $100,000 of grants coming in, to now well over several millions. But I would identify this from a concept out of kind of a change management process that talks about slowing down so you can speed up. We slowed down so that we could speed up to this point. So I don't know how it gets done any quicker. But again, those two major significant global events probably helped us in some ways, but it also did take some, I'd say probably a year and a half added on to what we would normally have done.
Okay, we have one more question from Karen Kress. In terms of working with communities on health equity issues, is care being taken to include the importance of medical research in this conversation, or is the focus solely on improving the provision of health services? After all, health equity has to include equal inclusion in medical clinical research. Otherwise, the results of research will only be specific to the participating populations.
So I will start, and maybe Dr. Nichols will join in. So currently with some of the grant work, there is a component of research that's being done. So the Black Birthing Initiative in and of itself does have some component of research. When we're thinking about informing the staff on what may help to get into next, as the board is really part of setting that strategy, and where we go to next is really building upon the data that is coming from the communities and being in the communities and what they're telling us, the initiatives and programs that we currently have in place with the grant funding, as well as moving forward with the data that we have around our partners and how we can use that from a research standpoint. So there's a lot of thought and plans as in the future strategic plan of health equity for us to really leverage that data, what we're currently doing, as well as getting into that. The other piece that we are really talking about is that advocacy piece, which I do believe will get to the point that you're articulating as to, how are people in underserved, underrepresented minorities involved in the research that is driving this work in the future. So that will definitely be something that the strategy of the organization is planning to engage in.
Just to add a few comments, I think it's important when you're dealing with a community, and we were very pleased to have principles as we moved through this initiative and foundational ways of managing. From a mission perspective, we need to commit above all to a mission of improving the health and well-being of individuals. And I think it's so important that you go in from that perspective, because as we know, the historical factor around communities of color, minority communities as a whole, in research. Research was not our initiative. Our goal as working with the community was the outcome, improving healthcare, committed to serve as a community as an engaged, responsive, and proactive partner, and to earn their trust and sustain those trusting relationships. As we were able to do that, the community themselves became engaged and were designed to make sure that those things that were working well for them would work well for others. And so key, important to, from a power perspective, from an equity perspective, when you're looking at the systemic things that occurred over many years, once again, unfortunately, you have to be patient in moving those opportunities and get the buy-in of community. And so those researches are absolutely important. We cannot continue to work without delivering on some of the things that will help improve the care and the health and the outcomes overcome. But most importantly, you do that with the community. You share that, you talk about what those outcomes look like in order to make sure that there's a partnership and driving toward what will be helping not only that community, but we hope will be an initiative that will help out nationally, improve health equity for all.
I wanna give Tom a chance to introduce Jean to everyone in the audience, but just very quickly before we do that, I just want to thank you all for being here today, of course. But more than that, I want to thank you all for opening up your organizational learning for other organizations out there who maybe are looking at doing something different, or even if they aren't, there's so much that I think would be of help to someone out there that and not all of us can really put all our learnings and troubles for everyone else to look at. So thank you all for being so frank and honest in all of our conversations. And we at WJ really appreciate it, and I'm sure that other organizations out there will as well. So Tom, please take it.
Sure. And thank you again and for having us. And as I introduced Jean, I just also want to communicate to anybody that's listening now or in the future, we're an organization that's very open to collaboration. I mean, that's what we are as an organization, as having lots of partnerships. We're glad to talk to anybody about going through this journey. But as I introduced Jean, it's very important to really note that what the benefits, somebody talked about the return on investment earlier, and you do have to look at that. Kevin always reminded me, this is not just a good thing to do, it's a sound business strategy. It's the right business strategy. It's where you really need to invest your time and your resources and talent. But it's infinitely worth it, because that trust that Sandra talked about is a net result of this. You begin to understand why the distrust is there, where people are looking for the right resources, and then you begin to really kind of form a different kind of a response to how you approach community health. I said it in my goodbye to the board. What the board taught me is the message is, don't do something to me without me. That's what a community says. Don't do it in my community without me, without involving me. And that's a good intro to Jean, because he's dedicated his life in public and private sector service to that very framework. And we were fortunate enough to be able to entice Jean away from AARP to be our new CEO. And Jean, maybe just closing us out. We talked about recruiting board. We talked about recruiting staff, bringing in new nonprofit and corporate partners. But you're one of the individuals we attracted to our cause. I think you coming into this from the outside, now the inside, maybe you could put kind of a capstone comment on this process that we've gone through and where you think it's going to take us in the future.
Well, first of all, thank you so much, Tom, and thank you to our fellow board members. As you can see, we have a very forward-looking, solutions-oriented board who has worked very intentionally over the course of many, many years to build on this amazing legacy that I am just a benefactor of. This is my 4th week. I mentioned to the team yesterday, I celebrated my my 1 month anniversary at CHC, and it's been an amazing journey. I think the title of this webinar and even the case study is really on target, and that is really our transformation. And you heard from our fellow board members and Tom how we have gone through this journey of transforming in terms of exactly the impact that we want to make collectively and to build on the amazing legacy of CHC for nearly 70 years. Has been an organization that has been at the front edge, the cutting edge of addressing the barriers to health. And we have an amazing opportunity now to accelerate and build on that amazing legacy, to think about exactly what will the next 65 years look like for CHC, and what can we do in partnership with our board to really make sure that we're making meaningful change. I think there's a couple of things that I just wanted to emphasize, particularly from today's conversation that you heard from our board members, that will be very critical to the next 5 years, the next 10 years. One is that this really is a collective responsibility, meaning the fact that particularly the issues that we see as relates to the inequities across our communities really impact lives. And what we mean by that is that where you live influences how long you will live. And we have an opportunity, particularly given where we sit at the intersections of business and of government, of philanthropy and of nonprofits, to channel those sectors in a way to solve this collectively, because no one sector can solve these issues in isolation. The other thing that you heard from our board members and Tom is that there's opportunities and innovations taking place across communities. So how can we really spotlight, highlight, and elevate those in a very meaningful and intentional way to scale for impact? You also heard around community integration and ensuring that the voices and lived experiences of communities are reflected in policy and advocacy and program delivery. Well, CHC is an organization that's well positioned to do that and then some. And then the other aspect of this too is really kind of thinking about how we address the inequities that we see. For example, according to Deloitte, health inequities in the US cost about $323 billion in 2022. We know that there is a huge difference in terms of life expectancy by race, by gender, by ability, by geography, by sexual orientation. And that actually stifles economic growth, which impacts everything. So what you'll be seeing is really our efforts to really elevate the solutions to close these gaps, to work with our partners at the community level, to bring out the community voice, and to showcase what is actually working and what we can do collectively to close those gaps. The more intentional we can be, the better off we all will be as communities across this country. And equally important, and I love what our board members talked about, is that we have an important opportunity to work with all of you to really think about how we solve these issues in a very meaningful and intentional way. What would 2030 look like if everyone had an opportunity to live to their fullest potential? What would 2040 look like if everyone had an opportunity to live as long as possible? What would 2050 look like if where you live was not a predictor of how long you would live, that you would have equal opportunity to spend time with your spouse or partner, to watch your children or grandchildren grow old, to be able to engage in moments that matter most to you? That is what we're talking about here, particularly at CHC, that there are opportunities to address the structural inequities, as well as opportunities to address the barriers and ensure that every community, regardless of what neighborhood you live in, regardless of what community you live in, have an opportunity to really thrive. And we can do that through a range of partnerships and engagements. And I'm really excited. And I just want to thank the board for their vision. I want to thank Tom for his servant leadership and his support and guidance. And I want to also thank all of you for joining us today. And hopefully you will join us in this effort, because we're all impacted by these inequities, and we all have an opportunity to close these gaps.
Thank you, Gene. Well put. Adam, do you want to add a couple words?
Yeah, I just want to put a finer point on, Jean's talked about Tom, Kevin's talked about Tom, Sandra, Charlita, and I've talked about Tom. We've talked about the role of the board in this transformation. Tom's talked about the role of staff in this transformation. I just want to talk about the role of the CEO and president. And we would not be where we are today without Tom's ongoing leadership and perseverance. This was not easy. This was not easy for Tom. Tom led operational and legal transformations 6-7 years ago, right about the time that I joined the board. We wouldn't be where we are today if Tom hadn't made those decisions and done that heavy lifting to create the efficiencies so that we could thrive. Tom, in terms of the board that he has worked with, we are not shrinking violence. We speak our mind, we engage. Tom's laughing now. I'm speaking truth. We speak our minds, we engage directly, we have frank conversations, and Tom was there every step of the way. He talked about it would have been easier to be just focused on a self-perpetuating organization. He could have gone down that path, but his focus on our purpose, defining our why, is why we are where we are today. So as you participants, panelists are listening to this today, if you were the CEO and president of your organization, take a good look at yourself and step up, because that's clearly what Tom did. And without that, you're not going to be able to succeed.
Wow. Well, I hope, Tom, that you have a wonderful trip planned starting next week and for the upcoming 6 months, and that you're not already overcommitted to, I'm sure, all the things that you have ahead of you. So thank you all, and you in particular, Tom, for all of your great work. Thank you everyone who attended the webinar. We've come to that time. So thank you very much. And we'll stop the recording and appreciate everyone's input. Have a nice day.
Thank you.